Hey, what's up? It's Victoria. If you're watching this and you're a nursing student in school right now and you have no idea of what area of nursing you want to specialize in, you might find this video very helpful. Or if you're interested in nursing and you like to become a nurse, this video might actually be very helpful to you and decide if neuro nursing is something you want to become. Or if you are watching this and you are a neuro nurse yourself, you might find this video very relatable, and I hope it reminds you that you are actually not alone. And lastly, if nursing is totally not your thing and you don't plan on becoming a nurse at all, this video might be very fun for you to watch because I interviewed 8 awesome nurses I work with. They are neuro nurses, asking them their best and worst experiences on the neuro floor. And also one advice they would give to anyone out there who's interested in this field, something they wish someone would have told them going into this specialty. I had so much fun interviewing my coworkers and what they had to say on our floor. It's extremely difficult, but it's very rewarding, and you're going to see and hear what my coworkers have to say. Best and worst experiences on the neuro floor.
I have been swung at, have had poop and pee thrown at me. If you're the type of person who could be like, yeah, that doesn't make my day horrible, then you're neuro appropriate.
Seeing patients recover from a stroke or going to rehab, like getting stronger, and their family is excited about it, is definitely the best experience.
The worst is when my patients pass away. That never comes easy. Always hard.
After a patient who was previously obtunded got a burr hole, he came back as his self prior to admission. So it's amazing what neuro can do.
I think the best experiences are when you get to see patients obviously getting better, which doesn't happen all that often on a neuro floor, I feel like. So it just makes it that much more special when you do get to see patients make progress.
I feel like the worst would probably be my first code. It kind of softened me a little bit more to take every life with like a grain of salt.
In terms of worst experience, I would say when I had a younger patient who unexpectedly had a stroke. A couple days after that, ended up out of nowhere just in a code blue, and we were not able to get the patient back. So that was definitely the worst experience that I had. Very unexpected and unfortunate.
So I think best would just be having a really good team to help you, because it's such a hard floor to work on, and if you don't have good teamwork, you'll drown. So I think coming to work and feeling supported every day is great.
Personal advice.
Sleeping patients are your most dangerous.
Keep your heart as a nurse. Like, you can get very closed off towards like patients and things like that, but just continue to remember why you went into nursing in the first place.
Don't be hard on yourself. It's a learning process. No one is perfect from the get-go. Give yourself some grace, learn from your mistakes. You'll be very proud of yourself after you give yourself a few more years.
It's a steep learning curve. You have to continuously learn, review your material to stay on top.
Advice that I wish somebody would tell me: go into being a nurse with really strong coping skills. Figure out how you're going to deal with all of the trauma and like heartbreak that you're going to see. If you don't, then the weight of it just kind of crashes down on you.
You can't do everything all by yourself. Use people to help you, and to not beat yourself up if you don't get everything done in a 12-hour period. It's a 24-hour job, and you have to constantly remind yourself that.
One advice, if you're entering into nursing, would have to be, don't do it. I'm just kidding. If you're gonna do it, make sure you walk into work every single day being willing to like learn something new, because you never know what you're gonna get.
Advice that I wish somebody had given me regarding neuro nursing is even when you think the patient's okay, they're not necessarily okay. So if you suspect that something might be going on, do more frequent examinations and just keep a close eye on the patients.
And I'm doing this, or I did this, because as a nursing student in college, I felt I didn't understand neuro nursing, along what it takes to be a good neuro nurse and what to expect. So when I did get thrown into the specialty, I was so insecure. It was so intimidating. I wish I would have heard about it more, had more exposure, and also way more knowledge than what I entered Neuro with. And during that time, the first, I would say 6 months, I started to lack way more confidence and felt even more insecure because of how much I was struggling, and it was like a big shock when you realize the more you know, the more you don't know. So I created this video to help some of you out there to bring neuroscience, neuronursing into light. And that was it for today. If you want to see more of this Nurses Live, please do like and subscribe to my channel. I hope you all take care, drink water, hydrate, sleep, get good foods, and rest.